Hey everybody, how you doing? Uncle Vinny here. You know what's coming up? That's right, Health Chat. Grab a cup of coffee, sit back, relax, and enjoy the show. Hey everybody, I'm Dr. Nick Circolone. You're listening to Health Chat. It's another Monday night. A little continuation of what we talked about last week about fear and anxiety, and give you a little bit about how the body works with fear and anxiety. But I do have a verse for you that I want to read. It's out of 1 Peter 5:7, and it says, "Cast all your anxieties on Him. He cares for you." We talked about last week, 365 times in the Bible, it is mentioned, do not fear. And if it was that important to God, it should be important to us not to fear. And I'm going to tell you what happens when we have this fear that turns into anxiety and envelops our entire life, and how all of that affects your health. Well, we talked a little bit about the ANS, or the autonomic nervous system, last week. The autonomic nervous system is your gas pedal and brake for the body. Your ANS has two parts to it. It has a sympathetic and a parasympathetic. We're not going to go into a whole anatomy of all of this. I'm just going to give you a little detail on it and then show you how it works. So the parasympathetic, okay, is more of your rest and digest. And your sympathetic is your flight or fight. Okay, so just from that alone, you can get an idea. So let's talk about something that occurs during stressful moments. Okay, our blood pressure is controlled mostly by the sympathetic nervous system. It actually has a constant contraction on the blood vessels in order to maintain blood pressure. And the parasympathetic, what it does is it can release all of that pressure in there. So here's the thing. If you're stressed out, your parasympathetic does not fire the way it's supposed to fire. Your sympathetic takes over and starts to compress those arteries and those veins, mostly arteries, and what happens is it increases blood pressure. So when you're under stress, your blood pressure increases. Makes sense. A lot of people deal with high blood pressure. A lot of people have cardiovascular incidents and issues. Well, a lot of that is your sympathetic nervous system really overdriven, and your parasympathetic can't slow it down. Think about this. You want that to occur during a flight or fight situation. You don't want that to occur during normal situations. So fear and anxiety kick in that flight or fight part of your autonomic nervous system. And that's what you don't want, because that's what's going to cause disease. Now here's the thing. Not only that, but your digestion, remember we talked about this, is controlled by your parasympathetic. Well, when that's not functioning properly, your whole digestive system is all messed up. So all the foods that you eat, everything that you put into your body, nothing is getting digested properly, nothing is eliminated properly, and what happens is we start to get sick. And if you've listened to some of my shows, we talked about headaches before. Sometimes you can have a constipation type headache, because that fluid that is supposed to be in your gut to help evacuate the waste is now absorbed back into the body, causing constipation and letting all of those toxins get back into the system, giving you headaches. So that's one way, is with digestion. Another way is with high blood pressure. Also, we can affect it through environment. We can affect it through the way we think, through the stress that we're under. All of these things affect it. So as a doctor, my job is to give you the information in order for you to live at an optimal level. We were designed to live optimally. We were designed to heal. Perfect example. If you've ever had surgery, or even if you've had a cut, if you put a stitch on it or you put a Band-Aid on it, it doesn't heal from the outside in. It heals from the inside out. That's how we're designed. We have to heal internally to externally. The same way with what stress does to us. We have to decrease that stress. We have to decrease that fear. We have to decrease that anxiety in order for our body to heal from the inside out. That's probably the hardest thing for us to really think about and do, is to think about, okay, my mind, my body, my soul, we have to get those in line with each other in order for me to heal. And when you heal from the inside out, you'll see the difference. There's a visual change or visible change in your body when we start to heal from the inside out. You know that from experiences with yourself. If there is something that excites you and ignites you, that inside comes out. It's the same way with our bodies. So if the autonomic nervous system is controlling a lot of this, and here's the thing, we can't control the autonomic nervous system. It does it automatically. I can't tell you to focus your eyes. I can't tell your heart to beat. They do them automatically. Most of the time, it's automatic. Yes, you can blink your eyes, you can cross your eyes and unfocus things, but try to stop your heart. You can't do it, because these things are controlled in order for us to live and maintain. Just like breathing. You can hold your breath, but you can only hold it for a certain amount of time before you go and take a deep breath back in, because your body will not allow you to hold your breath because you're going to cause harm to it. That's what happens when we're under stress and anxiety. Our body tries to protect itself. In protecting it, we actually damage it. So here's the thing. Start thinking about this stress that you're dealing with, this anxiety, this fear, and realize that you are literally causing damage to your body by what you're thinking, by what you're allowing to come in. Also, we damage our body and what we put into it. I'm getting more and more and more and more into, hey, my diet has to change. And what things are really good for me? Should I be doing the keto diet? Should I be doing the paleo diet? Should I be just eating fruits and vegetables? Should I be just eating meats? There's so many different diets out there, and some of them will work, and some of them may not work for long periods of time. We have to look for lifestyle changes, just like we have to find lifestyle changes to get rid of this anxiety and to get rid of this pressure that we're under in order for us to heal. Again, remember, your autonomic nervous system has this checks and balance. The sympathetic system is your flight or fight, and your parasympathetic is your rest and digest. So they have to work together. They will not work together when we're full of anxiety, when we're full of pressure, and when we have so much that's going on in our lives that we do run, 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 run. Think of the body as an engine. We have to feed it properly. We have to maintain it properly. We have to make sure that we're doing the right things in order for us to live long and productive lives. I don't know about you guys, but when I'm 80 years old, I keep telling you, I want to still be able to do one-handed push-ups. I want to be running at optimal levels. So what's that going to take? Decreasing my stress, decreasing my anxiety, making sure I'm putting the right fuel into my body, making sure I'm not doing things to hurt myself. These are all things that we have to take into consideration. But remember, I just gave you an example of how the autonomic nervous system affects your blood pressure. It affects your digestive system. It affects your heart rate. When you're in that fight or flight mode, what happens is your heart rate's going brrr, because it wants to get all of that blood to the areas that it needs to so you can get to where you need to be. You don't want to have a resting heart rate of 120. We have people that literally are having palpitations because of anxiety and stress. We can deal with all of this. Yes, there are medications that help alleviate a lot of these symptoms, but we're not changing our lifestyle. I'm not against medication, but I am against taking medication in order for you just to do your normal activities and continue to do what you normally do. You need to make that lifestyle change. Those medicines are great for getting you over the hump. Long term, they're going to cause problems. If you're hurting and you're taking a medication on a consistent basis, we already have research that that's going to cause a problem. If you have to take heart medication because you can't get your heart rate down, That's something that you might have to take. All medicine is to help us get to where we need to be at optimal levels. We don't need to be taking all of this all the time for every single thing. There's other ways that we can take care of our body. The parasympathetic that we talked about today, that's just one little thing in the body that we could do. There's lots more things that you could do. Remember what I said. It's a mind. It's your body. It's your spirit. All of this comes together to help you live productive lives. The older we get, the more productive we want to be. I don't want to be hunched over when I'm older. I don't want to be walking slowly. I want to be able to keep up. And you know as well as I do, there are people who are in their 80s, 90s that look way younger, act way younger, and have amazing mobility. But one of the secrets is taking care of yourself. Let's decrease our stress. Let's start eating better. Let's start looking at life a little bit differently. Remember, this is your health. There are ways to help you get through it. And I want every single one of you to live long, live happy, and enjoy the life that God has given you. Well, guys, God bless. We love you, and we'll see you next week.